go ahead and share my screen. Let's do this here. And this is about where we were. Okay. So I wanted to re-emphasize something and make sure when you pop in, there we go. What I wanted to do is re-emphasize about the okay, sorry, I got that internet unstable, so hopefully I'm not breaking up too bad. Can everyone hear me now? Okay, good. Let me illustrate something about the talking about the metacarpals of a horse versus the metacarpals of a dog or a cat. Again, the horse only has metacarpal 3, which is this bone, which is equivalent to this bone on our hand, which is the middle bone. And in the horse, everything below or distal to the carpus, below the carpus, has a name given to them. Now, in a dog, we would call this metacarpal 3. In a person, we call it metacarpal 3. In a cat. In a horse, it is actually referred to as the cannon bone. So I do want you to know the order from proximal to distal, that it goes from the cannon bone is there, which is metacarpal 3. They do not have metacarpals 2 and 4. Those are these splint bones, and they are actually fused to the caudal aspect of the cannon bone. And they think those were the 2 and 4s, and they fused, but they call them splint bones. And think about them splinting or holding on to the cannon bone. So we can think of it that way. If I go forward, again, you do not need to know the limbs on the cow. When we go below or distal to the cannon bone, then it is the equivalent of our finger. So on a dog, this is a digit, and one digit is made up of 3 phalanxes. So proximal phalanx, middle phalanx, distal phalanx. In a horse, that is this distal part of their limb, or it is below. So this is the carpus. This would be the fetlock, is the connection between the cannon bone to the phalange. So this is their fetlock. These 3 digits have names. Instead of proximal, middle, distal, this is called long pastern, short pastern, cannon bone. The cannon bone is the bone embedded in the hoof. And that is the most distal bone. So if I ask you, this is when I like to throw things out there to give you hints, what is the most distal bone in a horse limb? You would tell me the cannon bone. Now, everything proximal to the carpus. Coffin, did I say cannon? I meant coffin. If I said cannon. The most distal bone is the coffin. I may have misspoke. Okay, no, thank you for clarifying, because I don't want to confuse anybody. So proximal to distal, and this was my little saying, you get shot by a cannon, the pastor gives a long speech, then a short speech before the coffin goes in the ground. And I have students laugh when I say that in class, and I was like, you can either straight up memorize it. I was a type of person, I had to come up with weird sayings or thoughts to try and remember things like that. So if that helps you, then that's great. And remember, any of these little dots here, these little circular bones, are sesamoid bones. Sesamoid is just a round, irregular bone. And if I go back, sorry, I try to get it off this fade, but they have 2 sesamoids here, which are called the proximal sesamoids, which are in the fetlock joint. And then we have a distal sesamoid bone, which is called a navicular bone. Sesamoids are different sizes. Like the patella is the largest sesamoid. That is your kneecap bone. The patella is the largest sesamoid bone. And then you've got these smaller sesamoids. But horses can suffer from something called navicular disease. If that bone dislodges or causes a problem, then they'll call it navicular disease, meaning it's pertaining to that sesamoid bone. Okay. Now, again, digit 1, which is equivalent, like our thumb is, if you were weight bearing, okay, you can imagine my thumb isn't touching the ground, okay? So this is like the dew claw. And again, the dew claw in us is 1, if you can feel, you've got P3, P2, now P1's up in here, or you've got your, there's not as many phalanxes in the thumb. It's shorter than your other fingers. So like here, metacarpal 1, you only have proximal phalanx and you have a distal phalanx. I just want you to mainly know that digit 1 is the dew claw. And again, it is often removed in certain breeds, boxers being one of them. So you may get a dog and it does not have a dew claw, but this is always digit 2, which is like our index finger. Medial to lateral, okay? Digit 1, if there's, hopefully there's no questions on, and again, I spend more time on the front because the back is literally about the same. It's just metacarpals, metatarsals. So that's just the difference from the front to the back. Now let's get into the pelvic limb. The difference between the pelvic limb is it is attached to the axial skeleton. When I showed you yesterday, I showed you my pelvis. Okay, so when I showed you this yesterday, if my dog's head is this way and his tail is this way, okay, this is how the pelvis is going to sit. If you put your hand over your dog's back and you feel, you'll feel these bumps here. These are the wings of the ilium. And then the sacrum would be right about here. And so that is called the sacroiliac joint. So this, the ilium attached to the sacrum. So the pelvic limb has a bony connection. The thoracic limb is a floating limb on the outside of the thorax. So that's the difference. And now I'm going to work my way down. We're going to start with the pelvis, and we're going to work our way down from proximal to distal, and we're going to go through all those bones. Technically, it looks, this is called the pelvis, but the pelvis is made of 3 primary bones. They're fused. You've got the ilium. Now, we do digestive next term. I'm going to type this in really quick because people get this confused. There are 2 iliums that you will talk about throughout your education. Ilium in the pelvis is I-L-I-U-M. Ilium in the intestine is I-L-E-U-M. Okay, so when you spell these, they mean 2 very different things. You want to make sure you get the spelling correct and where the location is. I-L-E-U-M versus I-L-I-U-M. So the ilium is up here. Okay, this is the ilium. The ischium is this bone here in the back. So you can see the ischium are these bones right here. And then where they come together, it's hard to see, this would be the pubis. So the ilium, the ischium, and the pubis fuse to create the pelvis. I do want you to know the individual bones of the pelvis. Now, where they come together, or the pelvic, or called the pubic symphysis, is right here. That is a slightly movable joint. Remember we talked about fibrous joints, we talked about cartilaginous joints, and then synovial joints. This creates a little bit of stretching and a little bit of movement. So it's not a fibrous joint like we talked about in the skull. It's a little bit different. Now the obturator foramen are these two holes. And remember what I told you, if it's a foramina or foramen, this is where, remember, here's our spinal cord. And I said there's nerves that come off, peripheral nerves. Those peripheral nerves will go through that hole, and that becomes the femoral nerve that goes to the back legs. So it'll go through here. Also, the femoral artery and the femoral vein are going to basically branch off the abdomen and have branches that go to these holes, and that's where the blood supply comes from, okay? Now, very important to learn later is we've got this cup right here. This is the acetabulum, and this is where, obviously these two don't really go together. Let me get my anatomy straight, okay? So you would have the head of the femur sits in here, and that becomes the hip joint. And it fits in the acetabulum. When you talk about hip dysplasia later in classes, the acetabulum should be a cup. The head of the femur should fit in there tightly. When dogs have hip dysplasia, the issue is either this is really shallow, like it's flattened and not curved. It doesn't, and then sometimes the femur is not in place. And so when the dog walks, you get a lot of this rubbing, abnormal rubbing, and then we end up with a dog with arthritis and hip dysplasia. So very important for later classes that you remember the anatomy of, you know, what makes up the hip joint. We've got the acetabulum of the pelvis and the head of the femur. Now, coming up here, we're going to talk about the femur. The femur and the humerus look very much alike, okay? The difference is that there is a deeper trochlear groove, okay? The humerus is just a little bit shorter in most, and then the difference is there's this groove. This trochlea, that's where the pelvis is going to sit. And remember, epicondyles are above the condyles, which are like the rollers. The condyles are down here. They are going to connect, okay, to this is the tibia. And they roll when we bend the knee or the stifle. So we got the bending, and that's the condyles are articular. They articulate with the tibia. So this is the long bone of what's considered the thigh, which is the upper leg. I told you the head of the femur goes into the acetabulum of the pelvis. We've got the shaft, which is the long part, which is actually the diaphysis. And then you have the trochlear groove. Now this greater trochanter, which is this point, it's kind of broken off on this bone, but this is where the muscles of the hip attach and help move the hind limb. So it's a very important part of muscle attachment. Muscles attached to the epicondyles down here, and then the groove here is where the patella sits. Now I will tell you, I literally just did orthopedic diseases with my other class. When you have a dog that has what's called a patellar luxation, it means that this patella, it's not on here, it can basically pop out of this groove and it slides back and forth. Luxation is something moving out of place. Normally, this should be a very deep groove and the patella sits in there. There's a tendon called the patellar tendon. Quadricep muscles narrow to a patellar tendon, and if that's tight, it should hold that patella in place. So sometimes it's a weakening of the tendon. Sometimes this groove is very flat and it doesn't hold the patella and it slides. It's usually in little short Pomeranians, poodles, Pekingese, and you've got those short little legs, and sometimes due to anatomy, and it's genetic in those breeds, is that patella, you know, it's maybe this bone, it's the tendon, it's the groove. But the stifle is the distal femur and the proximal tibia. And that is the stifle joint and the hip joint. And again, the anatomy of those areas becomes very important. we work our way down. We're going down the leg. The patella, which I've already explained, is a sesamoid bone. It sits on the front of the stifle. It's kind of, in people, I never call it the kneecap in a dog. Sometimes I'm talking to an owner and I will tell an owner the patella and they were like, and I go, it's like your kneecap. And then they go, oh, okay. Behind the stifle, or on the caudal aspect back here, there are two little sesamoid bones called fibula. Now there is a gastrocnemius muscle that comes back here, and they are present in the tendons of those muscles. But I will tell you, I don't think I've ever heard of a doctor saying, let's look at the fibula or it's a concern. Most of the time, the issues we're going to talk about are the patella. And that's the one I want you to know. But there are two little bones back here in the caudal aspect called fibula. And sometimes you will see them on an x-ray. They'll look like two little dots, and that's what they are. Sorry. Distal to the femur is you have the tibia, and I'm going to talk about the fibula. Now, just like your forearm here is a radius and ulna, distal to your stifle, we have a tibia and a fibula. The tibia is like the radius. It is the weight-bearing bone of the lower leg. The tibia is very important. It forms the stifle joint proximally with the femur. Distally, it forms the hock. So if I look at this here, there is actually the patella. It's kind of hard to see. It's not always like perfectly round, but you can see right here, here's the patella, and then this is the head. This is the head of the tibia. You've got the fibula back here. Now see, the fibula is parallel with the tibia. It's not attached. I mean, they are attached, but there's like a gap between them, but they run parallel to each other. If a dog, just like I talked about on the forelimb, if a dog breaks the fibula and the tibia is intact, we usually a cast or just cage rest. If the dog breaks the tibia, it is the weight-bearing bone that needs to be repaired, usually with something, more than a cast. I mean, I guess it depends. If it's an incomplete fracture, it could be casted, but basically you have to do something because that is the bone that bears the weight. There's something here called the tibial tuberosity. It's hard to see in this picture, but we're looking at right here, this bone, that little point is the tibial tuberosity. And it helps form the tibial crest. So we got the tibial crest and the tibial tuberosity. Sometimes we will do surgery in this area for dogs with patellar issues because they can cut that and move it, and it'll change the angle of the patella. It's called a tibial transposition. So there's various, when you guys will get into that, like I said, ClinMed 4, Animal Tech 6, we talk about surgeries and orthopedic diseases, but I want you to understand where they're talking about. So we have a dog. Dogs have lots of stifle issues, cruciate ruptures. I should mention that is the femur and the tibia are held together with cruciate ligaments. Remember, ligament is bone to bone, tendon is muscle to bone. Those ligaments hold that together. So if a dog ruptures a cruciate ligament, okay, that causes the femur and the tibia to actually, now it depends, they have different ligaments that hold them together. I get into this more later, okay, but this is a stifle, okay. This is the femur, this is the tibia. I'm pulling this ligament back. There is the, what do you want me to spell, Sean? I don't know which word. Cruciate?
Yes.
That's correct. Oh, thank you, Teresa. That's correct. Cruciate.
Thank you.
Oh, cruise ship. I was like, what is she talking about? I need to drink more coffee. I got it now. I was like, don't know what she. You go into that more like in those. Thank you, Teresa. I put it down. Teresa, grab that with a quickness. This ligament, if you pulled it back, this tendon. Sorry, this is the tendon. This is the patella tendon. There's a little patella in there. You can see that bone. And when the stifle bends, it does this. If you look here, sorry, my light is not great. There's ligaments in there that hold them together so that this bone, I can't pull it forward, I can't pull it backwards, and I can't pull it side to side. I normally pass this around and say, go ahead, try to do it. But it's, if a dog tears, there's a ligament called the anterior or cranial cruciate ligament. If it tears, their femur can go forward. It's called cranial thrust. It means the dog has that, and then we've got to do repair. So I harp on this a lot. I feel like, I know, like you're going to learn this later, but I like to tell you why it's important to learn this so that when it comes up later, hopefully you remember talking about it. So you got the tibia and you've got the fibula. The fibula parallels, you can see it right here. It's parallel. There is a gap there. It just serves for muscle attachment. What's interesting is we've got this bone, and this part is more important for the stifle. Down here, the malleus is a knob-like process, and that is going to serve for a lot of muscle attachment as well. Now, like I said in the front, the metatarsals are very similar, almost exactly to the metacarpals, but technically, dogs and cats have 2 through 4. Some dogs will not have a dew claw in the back naturally. Now, again, if you get a pure breed, and a lot of breeders will have the dew claws removed when they're a puppy, usually about they're 1 week old, they get those removed. But there is a chance the dog did not have that metatarsal. I'm talking about, I'm sorry, when you have the dew claws removed, that's the digit. But what I'm saying is there's a chance if they had that there, but normally they don't. I feel like there's always that outlier that doesn't pertain to, but you can see back here, okay, there are four metatarsals. Now, in the horse, the front and back are exactly the same. The horse has metatarsal 3, which is the cannon bone, and then it has the digit number 3, which is the long pastern, short pastern, coffin. So the names in the horse are the exact same from the front to the back. Okay, if I asked for the scientific name of the cannon bone of the horse on the hind limb, it would be metatarsal 3. If I asked for the scientific name for the cannon bone of the forelimb, it would be metacarpal 3. So if that makes sense. But it's cannon on the front or the back. Long pastern, short pastern, coffin bone. That's the same. When you get into carpal tarsal, front, back, C comes before T. Now, if we look at, so we're just talking about these here. The tarsal bones in the, now I'm pointing to my wrist, but I'm talking about the ankle. The tarsus, or we call it the hock. It's a very common term to use in animals. I talk about the hock all the time. It is the tarsus, equivalent to the ankle. The top row or proximal has names. The distal row is numbered, just like the forelimb, okay? Now, I'm gonna go forward here. Typically, the phalanges, or we're talking about the toes, it is almost the same as the front. A lot of times it says usually they only have 4 digits. So this is what I meant to say about the dew claw. Some dogs or cats naturally will not be born with a dew claw on the back. But again, like when I got my boxer, I knew she told me they were removed. So he was probably born with one, but there is a chance that a dog or a cat may or may not be born with a rear dew claw. They almost always are born with one on the front, sometimes not on the back. I just want you to know, if you see a dew claw, it's digit number 1. And it usually only has 1 or 2 phalanxes, where the other toes will be made up of 3 phalanxes. So I hope that's clear. I didn't want to create confusion. Yes. Now, one thing I want to stress, maybe I didn't want to click that. Okay. This very large kind of weird bone right here is called the calcanean tuberosity. If you look at when your dog's standing, maybe even a cat, and at the back of their hock, there's a little point where a bone is sticking out. That back of the hock is called the calcanean tuberosity. On a dog's leg, if you go from the calcanean tuberosity and you feel proximal, you feel that very tight band. That is the Achilles tendon. Okay? If I go up the limb, okay, so if I have a back leg, the caudal thigh muscles, there's one down there called the gastrocnemius. The gastrocnemius narrows to the Achilles tendon and it attaches to the calcanean tuberosity, and then it pulls that hock. So it's a very important point of muscle attachment. It looks super weird when they're on their back, when they have a dew claw on the back. It's still connected to a digit. Yes, yes. Sometimes, and dogs, I didn't bring this up, but sometimes dogs, my dog that I had before this dog was a flat coat retriever mix. I got him from the shelter. He had these really flappy, they were called pendulous dew claws, like they literally like flapped and they kind of hung off him. And now the boxer I have, he has his front dew claws, only the rears were removed. His dew claw is super tight to his forelimb, like I can barely move it. So the presence of the dew claw is very different in dogs. And even cats that are called polydactyl, some cats have a double dew claw, and it looks like they have an extra toe. And it's literally called polydactyl cats. You can look it up. I can spell it. So some people really like polydactyl cats. They try to actively find polydactyl cats. Actually, Bernese mountain dogs. Okay, Madison, I didn't know if I couldn't tell if you were just telling me something or asking me. Yes, Ireland, I agree. They're super cute. Sometimes, yeah, my dog's dew claws felt like I could literally grab the whole thing, and it wasn't even, there is connective tissue. They are attached. Now my dog now, they are like super tight, like really close to his leg, but they are strange. There is a connection there, but it's more like with like connective tissue. But I would say there's some dogs, Great Pyrenees are a breed of dog that are known to have this kind of double dew claw, or they're like they look like polydactyl. So again, they kind of hang, but they genetically are prone to that, and certain cats are prone to that double dew claw. Okay. Now, again, the very important point to remember, if you look at a skeletal image, there's 2 very point. The olecranon on the back of the elbow is a point off the forelimb, and then on the back limb, we've got the point of the hock, which the point of the hock, if someone says that, it's literally the calcanean tuberosity. I want you to definitely know what that is. Again, tibial tarsal bone attaches to the tibia, fibular tarsal bone attaches to the fibula, and then you've got this calcaneus on the back. If you remember, there was the radial carpal bone, the ulnar carpal bone, and then there was the accessory carpal, which is on the caudal aspect, tibial tarsal, ulnar carpal, tarsal, I'm sorry, fibular. Do you see what I'm trying to say? The first two bones in the proximal tarsus are usually named for the bone they attach to, just like on the forelimb. The one that's on the caudal aspect, or the back of the limb, and on the front it's called the accessory carpal, and on the back it's the calcanean tuberosity. The other numbers are just two. We call it 2 through 5, and those are what these go through. So those are just numbers. The only one I really want you to know is I want you, for the carpal or tarsal bones, I want you to know the accessory carpal bone is on the back, and I want you to know the calcanean tuberosity is on the back. Okay, this is an example of the only one I want you to know that of bones and soft organs is the os penis. So the os penis is this bone here, and it is found in the canine, and there is a groove where the urethra goes. Inside the penis, the urethra is a tube that brings urine from the bladder outside the body. So a dog, or a male and a female, both have a urethra. That's the common tube from the bladder either out to the vulva or the penis. In the male dog, the urethra kind of sits in this groove. Now, it is very rare. We did see a hit by car, and when we did some x-rays, we did see a break in this bone. I think he kind of got rolled over. It's not really attached to anything. We knew it's probably just going to like heal on its own. We just monitored his urination, and we made sure he could make urine and that he could urinate, because if you imagine the urethra is running down that bone, if it was to tear the urethra and the dog couldn't urinate, that would be a problem. But the dog was making urine. It was a little bloody. He also got run over in the driveway, so I knew there was probably bladder, trauma. But as long as we kept making sure that he could urinate, this bone just healed on its own. So we didn't have to do anything. So I've had people ask me, do you have to plate that? Do you have to pin it? It's not really attached to anything. It's not supporting weight. You just have to make sure it's not affecting their ability to urinate, is the biggest key. Now, briefly, I've talked about a joint. Everyone, in my brain too, whenever I hear joint, I automatically think elbow, shoulder, stifle. A joint is anywhere where two bones have come together. They're joining. So there's different types of joints in the body. Again, if it's fibrous, well, let me get to each of these. Just to review, fibrous joints do not move. This would be your splint bones, the skull. You can see these are where these bones have come together. They've sealed. So right here, they're called suture lines. They're not going to move. You do not need to know the scientific term synarthries. I just want you to know fibrous joints are immovable. And if I ask you where is a location you would find this, you should be able to tell me. Splint bone, sutures of the skull bone. Okay. Some joints are called cartilaginous joints. And this is where I was talking about, remember when I talked about the pelvis? And I think I maybe said it wrong, but right here where the pubis has come together, there is a little bit of cartilage there. and it allows for a little bit of rocking. But if you think about, especially in a female, when her muscles relax during parturition, which is giving birth, it's going to allow the pelvis, when those muscles relax, to stretch a little bit. So there is a little bit of rocking movement between your discs, because your back has to move, in between the pubis, and then right here. The mandible is two pieces that come together right here, and that's called the mandibular symphysis. So symphysis is where two bones come together. Pubic symphysis, mandibular symphysis. And those are cartilaginous. But obviously, most of us think, when we think of a joint, we think about synovial joints. And those are freely movable. And they are typically the articular, you find synovial joints within a joint capsule. Synovial joints make fluid, synovial fluid, and that is what lubricates. Think about the parts in your engine. You would not put water where your oil, engine oil, is supposed to be. Engine oil is a little bit thick, okay? It has what's called viscosity, or the stickiness, but it lubricates your engine parts. Think about your stifle, your elbow, your shoulder as moving parts, and they need a lubricating fluid that is not watery. So that is, they have articular cartilage, they have covering every surface for protection, and then that joint cavity, which is the opening, produces this fluid. And then all joints need to have ligaments. The only ligament name that I've ever really talked about or stressed is the cruciate ligaments, cruise ship, ligaments in the stifle. We don't talk about the ligaments typically in the shoulder, the elbow. They all have ligaments, okay? But the main ligament that we see an issue with in veterinary medicine is the ligaments of the stifle, or the cruciate ligaments, okay? So that's... Now, anytime I say cruise ship in any class, I'm going to be talking, I'm going to think cruise ship. So I just think that's now been embedded in my, no, you're fine. No apologies. Little things like that just give me a chuckle, because now as I'm saying it, I hear it. I'm like, oh yeah, I can see why she got that. I will get more into this when I talk about muscles, but there's 4 things. The first 4 of these are the 4 main actions that muscles can do to a joint, okay? Here's my elbow. If I flex, well, let me go to, flexion is going to decrease the angle. This is 180 degrees. If I flex, I go to 90 degrees. If I extend, I go back to 180. Decrease the angle, increase the angle. So a joint can flex and extend. The other thing that a limb can do is it can abduct or adduct. The way I think of this is that this is going towards or away from the median plane, all right? If I have my arm and I abduct it, to abduct someone is to take them away. So abduction takes the limb away from the median plane. I'm going away. If I want to adduct my limb, I'm going to add it back to my body. Okay, abduct away, adduct it back to my body. Now, that's the 4 main actions of any muscle and any limb that it can have at a joint on the body. There are 2 different motions that can happen in the hip joint and the shoulder, and that's basically rotation. If you're a ball and socket joint, you can do all kinds, like my elbow basically is a hinge, open and closed. I mean, you can kind of turn this, but it's not the same motion as a shoulder and a hip. But I really want you to just know, I'm going to stop at this point. Well, let me bring up one thing, okay? All this is telling you is there's different types of joints. And if you think of your bones as mechanical parts. If it's a hinge, they move together. So here's the humerus, here's the radius, see that gap? And then this right here is the olecranon. So when you go like this, it moves, like think about a door. A door is a hinge. You can close the door and open the door. Close it. Okay, that's this acting like a hinge. If you have gliding, this is like a carpus. So you see all these bones? They basically, when you twist your wrist, they kind of glide together, rocking motion. If we talk about a pivot, it can rotate on one another, but it has a rotation movement only. Okay, remember, here's the skull. Here's the this is the atlantoaxial C1. Look at those big wings of the atlas. And then look at this big bump on the axis. And then look at the rest of these, how short those processes. But see, this is the transverse process. So this is C1, C2, C3, C4, C5, okay? But the atlantoaxial joint allows you to twist your head and turn it and turn it and turn it. Make sure everyone types here. I see, Alonza, I see you're in here, but I didn't see you right here. Okay, so make sure you type here so you get credit for being here. Thank you, thank you. Thank you. Okay, because I just don't want to forget that I saw your name, because that's how I do my attendance. All right, so rotate, rotate. That's like a pivot. And then what I've talked about, which should be common, is that your ball and socket allows for all 6 of those movements. The other joints only allow for one of the 4, or for the 4, like flexion, extension, adduction, abduction. This can do that rotation and circumduction. Okay, I know that was a lot. I would still like to get through. This is just my fear. If I don't do the test tomorrow, we still got to do muscles. And if I don't do tomorrow, then we would be doing the test Friday and I would only have 2 days on muscles. What I can do, let me unmute everybody.
His whole car is full.
Okay, hang on one. So I'm gonna mute everybody for a second, so everybody's being loud for a second. But what I can do tonight is say maybe 8 o'clock or 9 o'clock, we can do like a Zoom review. If I know you need to get to your class, but if I just log on tonight, like say maybe 8 p.m. And if we want to just kind of, it's optional. If you feel like you want to review, would that help ease some, I mean, I'm just shooting 8 p.m. because if other people have stuff to do, okay, so I'm getting, okay, let's do this. 8 p.m. Zoom, I'm writing myself a note. I will send out a link similar to, yeah, maybe 7 or 8 p.m. Just because I gotta get some other stuff done, and that'll give you some time to study. And maybe, usually when I have optional reviews, I have people bring questions they might have. Well, that's my concern, Sean, is that usually by the time my husband gets home from work and when we eat 7, okay, whatever doorbell just rang, my dog's running downstairs. Was that mine? No, I think that was somebody's house, not mine. Bobo, did you hear the doorbell? He's all looking around like, where is it? Okay, I will do that. So I can't put input in up at the RT. No, it's totally optional. If you can't be here, like a couple people are, writing, you could either bop in. I'll record it, and then I can record what people have asked, and maybe I'll get that. I'm getting better at getting these recorded and posted. So maybe what I'll do after the Zoom, I'll record it and send it to you guys. So if you guys are at work or something and you just want to play it later or like first thing in the morning. But what I want to do is basically we have to be able to go through that skeleton. I sent you the link, or let me do something. Let me get to a picture real quick. Normally, we label this picture for the test. I need to get some time to work on trying. Normally I do this on paper, so it's a lot easier. But what I want to review is you need to know the formulas for the dog and the horse. C, T, how many numbers are there for the vertebral column. The caudal, if like I had a little arrow pointing to this, you would tell me that's the manubrium. If I circled that junction, that's the costochondral junction. If I point to that, that's the olecranon. Here's what I was just talking about when we did the tarsus, when I did the hind limb, is that point is the calcaneus. And so that is actually coming off of a tarsal bone. So you've got the tibia and the fibula, and then attached here would be the Achilles tendon, and there would be a muscle here called the gastrocnemius. And when it pulls that calcaneus, and that's how the dog bends its leg. We've got femur, you've got your patella, tibia, fibula, radius, ulna. We've got our carpal bones, phalanges. So what I recommend is I had sent the link to that purpose game, and it literally goes through, and you have to, it'll say radius, and it'll, you click on the circle where you think that the radius is. And again, it will highlight the ones that you miss. If you keep missing the same one over and over again, it's going to, turn a different color. So this is the picture that I want you to be familiar with. The other picture we talked about, correct, the dog, not the horse. Correct. We talked about this bone. This is a basic long bone, but talking about the parts of a bone. So the top and the bottom are the epiphysis. This one is proximal, closer to the body. The other one is distal. And then the middle of the bone is the diaphysis. And then you have your medullary cavity, which is hollow. It's supposed to be filled with bone marrow, but it's a cavity, so it's open. And then this little periosteum here, it looks like a peel. Remember I said, think of a bone like a banana. And the banana peel is the periosteum, and then what you have underneath is the bone. So there is a covering to the bone. The inner lining is the endosteum because it's within. So endosteum versus periosteum. And then these are the plates, which is called an epiphyseal plate, but that's the growth plate that fuses when the bone reaches skeletal maturity. So it stretches and then it fuses. So what I recommend is The study guide was basically just if you feel comfortable with those questions, then you should be good. I've sent you a purpose game for the skeleton. I gave you a link to my Kahoot, and you have a study guide. I'm going to email you. I just have to check everybody's homework. That'll take me just a moment. As soon as I do that, I will email you the key for the lab exercises. And then tonight, optional, we can open up a Zoom at 8 to review. So I would go through all those resources if you have time and figure out where are you weak. I realize it's a lot of material, but like I said, if I push this, I'm going to be potentially like really cutting back muscles, and I got to get some of that done. But I'm, like I said, I'm willing to open up a little review tonight via Zoom, and I will record it for those of you that are at work. And those of you who are that are at work, you can always email me if you have any concerns or questions or things that you're confused about.
It's Sean, and I have one more question real quick.
Yeah.
We obviously stopped and didn't get to, you didn't like explain the different joints, like the hinge, the gliding, the pivot, and the ball and socket. We still are responsible for knowing that though, right?
Well, I'm not necessarily going to quiz you on the type of joints. I mainly wanted you to understand the movements that a joint can cause, the adduction, abduction, flexion, extension. And so I highlighted those hinge, ball and socket so that you could understand how those actions could happen. But I mainly want you to know the bones and and when I talked about joints, I mostly want you to know what is the difference between a fibrous joint, a synovial joint, and a cartilaginous joint. Fibrous, no movement. Cartilaginous, slight rocking motion. Synovial, freely movable. Because like I said, everybody's brain hears joint and you think movement instead, but there's anytime two bones come together that creates a joint, and there's different types throughout the body. So I'd like you to understand that more than the those different types. So my goal whenever, like I said, when I do after school reviews, I just say if people are going to come, try to have some questions, try to think of some things, say, can you please go over the vertebral formula again? Can you please explain the difference between the joints? We can definitely go through the skeleton and go through this. There is also on purpose games labeling this kind of a bone. You could write in long bone. I'll see if I can find long bone purpose game. I'm writing, okay, record. All right, what I'll do with the key to the homework, I will try to find that purpose game for the long bone. And then I've already, for Kahoot, I cannot, if you've not played it before, you literally just go to the website. You can search for my username, which I put in that email, is J&G-Mama, 1M. I'll type it here just in case. Okay, my games are public, so you would just find the one that says bones and you can play it. Whenever I try to send the link, it doesn't work. I've made it public so you can just open it. So I would play that. I would play purpose games. I'll send you this. Review your study guide to make sure you're familiar with those concepts, and then you can log in tonight if you'd like. Shoot, it's 11. Are you guys good? Kind of? Okay.